literature. So the contents for today's presentation would be as follows. Introduction. So COVID-19 is basically comprised of 4 stages, namely the upper respiratory tract infection, the onset of pneumonia, leading to a hyperinflammatory state and ultimately death or recovery, depending on the patient's condition. The prevalence of coagulation abnormality in COVID-19 patients has been seen to be about 20%, and it is most commonly seen in patients in the critical stage of COVID. Also, venous thromboembolism has been found as a potential cause for many unexplained deaths in the COVID-19 cases. The 3 main factors contributing to this coagulopathy are as follows. The 3 main conditions of Virchow's triad. The first one being the endothelial cells are directly injured by the release of from the ACE2 receptors, which releases cytokines and acute phase reactants that causes endothelial injury. Immobilization due to the hospitalization of severe or critically ill patients results in stasis. An increase in the circulating prothrombotic factors such as von Willebrand, factor 8, D-dimer, fibrinogen, all amount to a hypercoagulable state. Ovarian vein thrombosis. It is a serious condition caused by COVID-associated coagulopathy. It occurs most commonly after childbirth, which has a very low incidence rate, but there are other rare causes such as malignancy, abdominal or pelvic surgeries, sepsis, and pelvic inflammatory disease. The symptoms most commonly include pain, particularly in the right lower quadrant and lower abdominal quadrant, and it can radiate to other sides, and fever. The most specific feature for this is a palpable abdominal mass. Thus, early diagnosis and treatment is crucial to prevent life-threatening complications, which include extension of the thrombus, pulmonary embolization, sepsis, ovarian infarction, among many others. The main clinical suspicion and imaging modalities are important for diagnosis. Although OVT has been reported rarely, but the possibility of ovarian vein involvement is also a very severe thing to be on the lookout for. The actual magnitude of OVT cases may still be unknown, as COVID cases have been underreported during the pandemic. Thus, it should be considered in patients with acute abdominal symptoms and a recent history of COVID-19. Methodology for my study included extensive search on the PubMed, Google Scholar, and Medline with the following keywords, and ultimately 8 publications met the criteria for my research. The clinical profile of patients was that COVID thrombotic events were most commonly seen in the critically ill individuals with severe pulmonary disease. Around 40% of patients in the COVID-19 patients are admitted to the ICU, and VTE cases were more prevalent in the ICU patients compared to the general ward patients. OVT was rarely associated with COVID-19 pneumonia, but common symptoms included the fever and right-sided pelvic pain. Right ovarian vein thrombosis was observed in 70 to 90% of cases due to the uterine dextrotorsion and valvular incompetency. OVT can cause severe life-threatening complications, as already discussed, such as thrombus extension, and thus reported extension was seen in iliac vein, renal vein, and pulmonary vein. Although the origin of this thrombi is unclear, they need to be monitored as they can be fatal. The lab parameters. As it is an inflammatory state, OVT was associated with high D-dimer levels, and the severity of COVID-19 was correlated with increased D-dimer levels. COVID-19 causes changes in the prothrombotic factors and inflammation, so elevated levels of pro-inflammatory cytokines and acute phase reactants are seen in OVT cases after COVID, indicating that there was a connection between inflammation and thrombosis. The diagnosis and management of these patients was similar to the normal management of OVT, which included 3-month anticoagulation for symptomatic patients, although asymptomatic patients were not required to be given anticoagulation. In conclusion, we can analyze that COVID-associated coagulopathy can lead to rare but serious complications, including ovarian vein thrombosis. OVT in COVID patients mimics acute abdomen and requires careful consideration to prevent life-threatening risk. Early diagnosis and management of OVT are vital for successful treatment and preventing further complications. Thank you for your attention for this presentation. I would like to ask if anyone has any questions for me.